Good morning. My name is Stephanie Nolting. I'm a physical therapist at PT Connections in Pueblo, Colorado. As physical therapists, we get a lot of people after surgery, and one of the questions I get very often is, how do I manage the pain right after surgery? And so one of the things that the body creates while it's healing is a lot of swelling, and swelling has a huge role to play right after surgery. So the better you are managing your swelling, the more you're going to be able to keep your pain under control. So some of the few things that we talk about with swelling is compression. And so I'm going to demonstrate with a very thick elastic band, but an ACE wrap would be a better choice to use, or even compression stockings. And some surgeons will give compression stockings for the lower extremities to help decrease your risk of blood clot right after surgery, but we will use it to help manage swelling in addition to reducing risk of blood clot. So even though a surgeon may only want you to wear those for a limited amount of time, the first few days or week after surgery, for managing your swelling, you might use it long after that. A lot of people will choose to use compression while they're up and around and busy, because the more active you are, the more likely you're going to be creating more of that swelling, because it creates a little irritation, especially like in a knee, after knee surgery. But foot and ankle, anything in lower extremities, even in the upper extremities, but I'm going to demonstrate on the knee today. So if you had swelling in the knee and you wanted to get your ACE wrap at home, you want to start off with the knee in a fairly straight position. As you wrap around, you don't want to wrap straight around like a tourniquet, because your ACE wrap will act exactly like that, like a tourniquet. You want to wrap it like a candy cane, so that as you go around, you have a diagonal pattern. So higher on one side, lower on the other. As you continue to go around, you want an even amount of coverage from one layer to the next, because if one was a real thin layer between and the other is thick, then you're going to get different amounts of compression throughout the whole ACE wrap, and you want it as even as possible so the fluid knows where to go and what to do. If we didn't wrap it evenly like that, then the fluid will pocket into areas where it has less compression. So keep it like a candy cane, make sure you have even amount of distance between each layer, and then as you continue down the leg, you want to have it more firm at the bottom and less firm at the top, so that the funnel effect you're creating will make that fluid want to drive into the upper part of the body, the abdominal cavity, where it can process them and eliminate some of that extra fluid. Elevation is another huge part of keeping fluid under control. So if you've got multiple pillows at home, what you would want to do is put one across long ways at the foot of your bed, and then get two other pillows that you can prop with that way, so that you're creating a heel for the entire leg. So a lot of people after surgery will hear from their surgeon, don't put a pillow under the leg, especially under the knee. And what they mean is, don't put it under the knee this way where your knee can be bent, because if you're laying there for a prolonged period of time, even 10 minutes, some of that fluid from the knee has the potential to drain into the foot and get trapped there, and it has to work back through that area that's still producing more fluid as you're healing to get into the rest of the body cavity. So when you produce that long heel, then you have the foot higher than the knee, higher than your heart, so that fluid can drain into your body cavity and then be processed. And that should be a much more comfortable position to tolerate for a prolonged period of time. A lot of times people will try to have it that way, but when the leg is up that high and there's no support under the leg here, it's not very comfortable to tolerate that for very long. So the longer you can be there, a good 20 minutes, you're going to get much more effect for getting the swelling out of the leg. Also drink plenty of fluids to flush out all of the fluid that we don't want in the body, because there's good fluid and bad fluid. And then also the healing process takes a lot of extra water. So whatever number of pounds you weigh, take that number in half and shoot for that many ounces of fluids a day. Hope that helps with your swelling and your pain. Good luck. And if you need us for anything, give us a call at 719-565-6678.